And so today we're going to be talking about Mexican American culture, family, pregnancy, and nursing care. My name's Ashley,
My name's Bianca.
My name is Kimberly.
And my name's Tanya.
and so we're going to go right ahead and jump in with our first slide titled Family Structure and Roles. So familialism is essential, emphasizing strong bonds with both nuclear and extended families. And then we have our second term, Marianismo, that basically means that it places high value on motherhood and caregiving. And then another point is fathers are expected to provide lots of paternal support, while mothers fulfill the central maternal role. And then family involvement during pregnancy is common. Relatives usually actively support the mother with food, chores, or emotional care. So now we're going to move on to traditional beliefs, pregnancy, birth, breastfeeding, and childcare. So pregnancy is viewed as a blessing from God, and women feel privileged to be pregnant. A lot of times, a lot of Hispanics will be like, "Oh, thank God I got pregnant," or "God is sending me like a little gift," and things like that. Family members also play a strong role in promoting healthy pregnancy behaviors like balanced rest and diet. And family members do play a big role in this. They will be like, hey, like I'll take care of your baby while you can go get some rest. Especially the mother. The mother really helps the daughter a lot. And then women expect and rely on postpartum family and partner support to transition into motherhood. So basically, like I said, during postpartum, the family and the partner will try to go above and beyond to just provide the best support for the postpartum mother. And then Mexican American women often incorporate the maternal role into their identity and they find deep meaning in motherhood. And that's basically just saying that Hispanic mothers specifically, they take their role very serious and they just want the best for their baby, the best for their family. And personally, from coming from a Mexican American family, I can see that from the first person point of view.
So I'm going to be speaking about some myths and fears in this culture, specifically with having a child. One of the fears is just having a baby being born with deficits. I know this is probably common amongst all cultures, but specifically just for Mexican Americans, I know like that's a big one. And as Ashley was explaining, just the family role and how many people do help. Like, I know what they always say, like, it takes a village, but like it really does, especially with a child with deficits. Um, and this is just, more linked with just cultural beliefs, and obviously it increases anxiety. Let's see. Another one is that pregnancy-related fears may include dying during childbirth, influenced by memories of limited health care in home countries. So obviously, giving birth is a serious, not really procedure, but a serious thing to go through, and dying during childbirth is something that is common and is definitely a possibility, especially, like I said, in the home countries where maybe medicine or the healthcare isn't as good. We are so lucky that we are here in America, but I know that everybody around the world is not as lucky as some of us. So that's definitely something to take into consideration. Another thing is that women sometimes feel pressure from family expectations to sacrifice their own needs. Some examples is like avoiding medications to protect the baby. And it is something serious to think about things that you do have to give up. Becoming a mother, there is a lot of sacrifices that you have to make. Um, and it sometimes it's a big what's more worth it, again, is it better for the mother? Is it better for the child? Specifically in this culture, it's better. We need to keep the baby safe as much as it will hurt the mother. So, another thing is that anxiety and cultural beliefs about pregnancy can lead women to believe that their emotions or stress may harm the baby. So this is kind of similar to the one before. Um, they try to do their best. Women, us, we try to do our best to keep our emotions regulated and keep our stress levels to a low, but obviously having a child does increase anxiety or stress because it's just a stressful time in your life. Even if you may be excited, it still can be stressful. So, um, we're really taught, and I'm saying we because all of us happen to be Mexican American, that like we need to keep our emotions basically in check for the baby. And then the diet and food preferences is the next thing that I'm going to be talking about. And pregnant women are encouraged by the family to eat healthy foods for the baby's benefit. Again, basically in our culture, it's like we have to do everything for our child, um, which is not a bad thing. It can be, but it's always encouraged to, hey, do the best that you possibly can, even if it does affect the mother in a negative way. Family members often bring the mother food and drinks as special care to reinforce that communal support. And like I said, as Ashley mentioned before, it's really a village when a Mexican American becomes pregnant. Everybody kind of helps. They bring a lot of good food, again, for the baby's health. Um, and it's just awesome that there is a lot of help involved. Yeah. Maintaining a balanced activity rest pattern is emphasized for the maternal and fetal health. I mean, we obviously all know how important it is to sleep and rest and do um, everything that you can to make the baby healthy. And then the last thing is that food and rest practices reflect broader cultural traditions of maternal care, not just individual choices. Um, and this just kind of includes, like it says right there, postpartum care can include soups and teas. It really promotes that comfort and healing, especially, like I said, in Mexican American cultures, like menudo, albóndigas, like everything that we eat, there's a purpose for eating it. And again, it's just to make the baby healthy.
Mhm.
Next, we're going to be talking about cultural behaviors and communications. With this, we often see that pregnant women, they get treated special, and it could be said they have a special status. We see a lot that the women, they begin receiving a lot of affectionate touch and a lot of care from the family. It's just in this culture, there's a lot of loving relationships and caring relationships. And with the mother being pregnant, they want to make sure that she's getting the best care possible just to ensure that she has a healthy pregnancy journey. As well with the touch oriented, they often get help with anything they need. They are offered hugs, and this is a very caretaking culture. And this may also lead to some restrictions for the mother. They wouldn't want her to be doing tasks just to ensure that she's not overstressing herself or nothing will happen to overcomplicate the pregnancy. So we will often see that the relatives, they may be hovering over protectively over the woman. Um, but it's just that we see with this that it's a very carry environment. And the communication type with pregnancy, anxiety and fears, it's a common thing. And the way they communicate with expressing that they do have fear and they may be anxious about the pregnancy. This may be due to the fear of possibly losing the baby, pain that they may experience, or in any defects that may be caused. And they may also express their fears about the labor process. They might um, depending on whether it's their first pregnancy or any history of their hospitalization that they had, they may have fears about that. And the way that they also communicate and express their fears and anxiety, um, they cope with prayers. Prayer is an important thing. They also talk with their families, they communicate, and they try to find ways to distract themselves. But overall, they do like to show emotional expression. And since they know that this is a very caring environment, they know that they could depend on people, so they freely express their feelings. And then with religion and spiritually, with pregnancy in this culture is often seen as a miracle and a divine blessing from God. So this really helps shape their maternal attitudes. At the start of conception, they begin to see it as a blessing and they get more into the maternal side. Since they see it as a gift, it's a pregnancy is a very exciting thing for them. And this is where we also see their family being very helpful since the whole family also sees it as a blessing. And prayers are often made for the women. And we also see they find a lot of comfort and protection through prayers. And they see their religious beliefs as a way to protect them from anxiety and anything during pregnancy, and it helps manage some of the stress that they may carry. And then with death and organ donations, some families they often resist to organ donations. This is based on their belief in keeping their body whole. And with death, as mentioned, religion is an important thing in this culture, so they might have the beliefs of spiritual continuations, and they often do prayers and rituals for comfort.
All right, so now we're going to be moving on to culturally relevant nursing care. So what this means is it involves extended family and education and decisions. The women also like they do like we said support religious coping. So we're always like, oh, gracias a Dios, like we're gonna pray that everything goes well during labor and stuff like that. Like we really are big on praying and anything that has to do with that, like, oh, vamos a orar para que todo salga bien type of thing. Address pregnancy anxiety as normal. We have to offer reassurance, and then encourage positive prenatal expectations linked to reduced depression. So, like we said, we're big on family. So, we don't just take care of like the patient itself. We also have to involve them in the education and like the planning and stuff like that for them to just feel like we're not ignoring them, like we've said in previous discussion posts as well in this course. Family takes a big importance when it comes to that. And then, like we said, nursing, as nurses, we also have to respect their religion and involve that in their education and their care plan, as we say. So now that Ashley, Kimberly, and Bianca, we all talked about like the Native American and how to do with this, we're gonna bring that all into real life because I interviewed my sister. She's a Mexican American mother of three. So I'm just gonna be, I asked her a couple questions and she gave me a couple answers, and we are bringing that all together into a real life basis. So the first question was, what role did your mother and husband play during your pregnancy? So Jasmine, she's my sister, she's my oldest sister, and this was her answer to that. So my mom was really involved. She always checked on me, cooked for me, and made sure I didn't lift anything heavy. She would remind me of little things like no subas las escaleras, which means don't go up the stairs, or come más caldo, eat more soup, like Bianca had said, like albóndigas, caldo de pollo, chicken soup. So, like that. And then my husband was supportive too. He went to appointments with me and made sure I had what I needed at home. But the day-to-day reminds mostly came from my mom. It felt like a family effort. The second question was, were there any traditional beliefs you followed while pregnant? So yes, I was told not to get scared during an eclipse or else the baby could be born with a cleft lip. My mom also told me not to tie knots or wear necklaces because it could cause the umbilical cord to wrap around the baby's neck. I didn't always believe it, but I still followed it just in case. Also, my family said to avoid really cold foods during pregnancy and eat more warm meals, especially soups like albóndiga, menudo, pozole, stuff like that. And then, going back to the eclipse, she would put like a little red bracelet around just because they said like it helps to prevent like any defects in the baby. So then we move on to the third question that I asked my sister Jasmine. What cultural practices did you follow after giving birth? So postpartum. So this was her response. After my first baby, I did la cuarentena. So the 40 days where you rest, avoid heavy chores, and eat warm foods such as soups. My mom made me chicken soup almost every day and special teas. I wasn't supposed to leave the house much. Um, and definitely not go outside with wet hair because they say you'll get sick. So she'd always be like, "Cúbrete las orejas." So she would put like cotton inside the ears, especially like, oh, she'd be like, "Be careful because it could rupture your tympanic membrane and stuff like that." And then my family really believed in keeping me warm and cared for. Even if I felt fine, they would tell me to stay wrapped up and let me do the work. So like my mom, for example, like she would clean around the house, stuff like that. So then the fourth question was, how do you feel these traditions affected your experience as a mom? And this was her answer. Honestly, it made me feel really cared for. Sometimes it felt restrictive, like I wanted to go out or eat something else. But overall, it reminded me how important family is in our culture as Mexican American women. Um, sorry. Yeah, but overall, it gave me a sense of pride in being Mexican American, passing those traditions on to my kids. And yeah, so that was my interview with my sister after doing our research on it as well. And then this is our reference page. So yeah, thank you very much, and I hope you guys enjoyed our presentation.